On our previous video on the introduction to the endocrinology, which I'm going to drop the link down below in the description section, we literally talk about a lot of things concerning the endocrinology, which we said is simply a combined word. The endocrine and then logy. The word logy simply means study. When we combine the two words, endocrinology is simply the study of glands that produces hormones. And when we said hormones are simply chemical messengers that control various bodily function. Such various bodily function can be things like the growth and development, metabolism, reproduction, electrolyte balance, stress response. And notice that the endocrinologist diagnose and treat problems related to hormone imbalance. But in today's video, we are going to be focusing on disorders that has to do with the endocrine. So I will try to make it ridiculously easy, which I'm going to start with problems like diabetes mellitus. So if you zoom in to my screen, this is a roughly sketch of what we call the pancreas. And notice that pancreas is what produces insulin, right? So when we have overproduction or less production of insulin, it's simply going to be a problem also. And notice that the overproduction of insulin, which is high, is what we call the hyperglycemia. And when we have both of them, either high or low, we said is going to cause a problem. And the less production is what we call hypoglycemia. The difference is hyper, ER, and hypo with O. Apart from the insulin, the pancreas also produces another hormone which we call the glucagon. But if you're interested in understanding the intricate dance between insulin and glucagon, I'm also going to drop the link down in the description section. So I notice that this is what we call the liver. The liver stores some form of glucose which we call the glycogen. At some point, in some cases, that glycogen have to be converted into glucose so that our body can be able to use it. So let's talk about the diabetes this time around, since we have understood the basic structure and how it works. When we say diabetes, it's simply a condition where the pancreas does not produce enough insulin or the body cannot use it properly. This leads to what? High glucose level, which is in the blood, because when the insulin has to enter our blood. From our blood, it has to contact through the membrane for glucose to be able to enter into our cells. So this leads to high sugar levels. The high sugar levels is what we call the hyperglycemia. This causes things like fatigue, tiredness, and also increased taste. You can, people that experience this kind of problem, they tend to experience a lot of taste, like they need water constantly, with frequent urination and sometimes blood vision. And over time, if this continues without treatment, this can lead into serious complications like nerve damage, kidney diseases, and heart problems. So, other two endocrine disorders which we have is what we call the hyperthyroidism and hypothyroidism. The word hyper, H-Y-P-E-R, this simply means too much, right? Example, we can have hyperactivity, while hypo, H-Y-P-O, this means too little, like feeling too low or underactive. So in this case, we're going to have two problems, which is the hyperthyroidism, which is too much, and hypothyroidism, which is too little. But both of them has to do with what we call the hormone. So when we have hyperthyroidism, which is the first one, when we have hyperthyroidism, this is simply a combined word. The hyper, which means too much, and the thyroid, which is the gland, right? And the suffix dism, or rather ism, which indicates a condition or a disease related to the thyroid. Because everything we're talking about is based on thyroid. Because, the hyperthyroidism and hypothyroidism has to do with thyroid. Because we have thyroid gland, which is the location is on our neck, I think. Yeah, it should be on the neck. It also produces some hormone, which is very important for the human body. What will happen when we have overproduction or less production of these, of hormone which had been produced from this thyroid, right? The first thing that will happen when we have the overproduction, which we said the hyperthyroidism, this literally speed up a metabolic reaction or action, right? And it can cause things like weight loss and anxiety, and sometimes even fast heartbeat. So the next one is this, which is hypothyroidism. The hypothyroidism is similar to hyperthyroidism but opposite reaction. If this speed up a chemical reaction, this is going to if this speed up a chemical reaction, this is going to decrease the chemical reaction. Rather metabolic reaction in human body. So, and notice that this is also a combined word, which is this. It's also a combined word. We have the hyper, right? Hypo, which simply means low. We have the thyroid, which is the gland, and we have the ism, which indicate maybe a sickness. When the thyroid gland actually produces too little hormone, this is going to cause an inverse reaction. Instead of fast metabolic reaction, it's going to be low metabolic reaction in human body. So, instead of fast, it's going to be low, right? And again, instead of fast heartbeat, we're going to have a very slow heartbeat. And other problems is going to be things like the fatigue, muscle weakness, and low blood pressure. BP, which is the blood pressure. Another endocrine disorder is what we call the PCOS. This has to do with women, right? PCOS. The word PCOS is simply an abbreviation, also known as the polycystic ovary syndrome. It is a hormone imbalance in women that can cause, or it can lead into irregular period, acne, and difficulty in getting pregnant. This results when the woman ovaries produces, this is what we call the ovaries, when this when this ovaries produces too much androgens. The androgens is a male hormone, and this is what causes the imbalances. And sometimes this can cause like a hair growth in unwanted area that is in the female body. So managing PCOS often involves lifestyle changes, example like eating healthy food and exercises. So, but sometimes medication to help the balance and hormones improve symptoms. Other endocrine disorders which are common are what we call the growth hormone disorder, right? So this literally happens when there is too much or too little growth hormone. This can cause gigantism or dwarfism. The gigantism, I think, it should be derived from the word giant, and the dwarfism should be derived from the word dwarf. Gigantism and dwarfism. What literally this does, it affects height and development. Another important endocrine disorder which we need to talk about is the hyperparathyroidism. We have the parathyroid, which are behind the thyroid gland. What really happens when we have the hyper, which is the elevation of hormones produced by the parathyroid? This happens when the parathyroid gland produces too much hormone, which can lead into weak bone, because this has to do with bones, and kidney stone. It causes kidney stone when we have hyperparathyroidism. So, what really causes the kidney stone is overproduction of hormones produced by the parathyroid. So, why? Due to the excess calcium in the blood. So another problem which we need to look at is simply the Addison disease. Addison disease. This occurs when the adrenal gland, we have what we call the adrenal gland, and we have things like the cortisol attached to that, gonadotropin hormone, and we have the ACTH. So what really happen in this case? Okay, this is the briefly diagram which can cause it, because when we have overproduction of both hormones from the cortisol and the adrenal gland, this can cause the Addison's disease. And the symptoms can be, we have the fatigue, loss, and low blood pressure, and this really literally happen as a result of autoimmune response. So, but let's take it once more. We said this occurs when the adrenal gland don't produce enough hormones. Sorry, I made a mistake, I think. This happens when the adrenal gland don't produce enough hormones, particularly cortisol and aldosterone, right? When it doesn't produce hormone, this is what happens. So symptoms include the fatigue, we have the weight loss, low blood pressure, and a lot of times even darkening of skin, which can actually often happens as a result of this, which is the autoimmune response. Autoimmune response, in case you want to ask, okay, how? This simply happen when the body attacks its own adrenal gland. Another problem which we need to look at is the Cushing syndrome. So this also fall around this point. This literally happens when the body produces too much cortisol. When there is overproduction of cortisol, it can lead into Cushing syndrome. It can be due to overuse of steroid medication or a tumor in the adrenal or pituitary gland. Symptoms include weight loss, gain, especially in the face and abdomen. So this is it for this problem. I hope you find it helpful. Please, if you do, don't forget to click on the subscribe button. Please, even if you don't, this is supposed to be fun actually. Just do me a favor by clicking on that subscribe button. I promise to make it better next time. See you next time, and thank you for your time. On our previous video on the introduction to the endocrine